Welcome to the Performance Prescription Lab podcast, very first episode on the Paralympics. We are going to dive deep into the world of sports through the lens of pharmacy, health, and performance. And I'm Jess. I'm joined today by my co-host and dear friend Nilham. Today, we're going to transition into the Paralympics from our Special Olympics episodes we've been having. Paralympics deserves equal attention and recognition. And then further, we'll actually dive into a little bit at the end of this episode of the differences between the Paralympics and the Special Olympics, which are sometimes confused, but they serve distinct communities in our world of sports. This episode is truly special to my heart because I have a younger brother who is intellectually disabled, but he has volunteered daily for the last 20 years at our high school supporting athletic programs. And as a sister and somebody, I just love seeing how sports and the athletic community has looked past his disability and his imperfections and has allowed him to make a way to make his own contribution to the world. And it's just cool because he's been loved by our town through sports, and he has truly found his calling in the world through sports. So this episode is truly special to me.
Yeah, that's such a great story, Jess. And sports is for everybody, and it has so much power. It can engage everyone into a single goal. And participating in sports in any form has the tremendous ability to enhance someone's self-esteem and confidence. As an amateur athlete myself, I found my true power when I participated in different sports. So we are very happy to be celebrating the Paralympic episode today with our listeners. The Olympics are often seen as the pinnacle of athletic achievements, but the Paralympics are equally important. It showcases the incredible feats of strength, determination, and resilience. Olympics and the Paralympics, they both require equal celebration. The Paralympics and Special Olympics may differ in their structure and purpose, but they share a common goal. It's to showcase the incredible abilities of athletes with disabilities and to inspire us all to be more inclusive, more accepting, and more understanding. While the Special Olympics and Paralympics are sometimes used interchangeably, they cater to different groups of athletes, each with a unique story, purpose, which we will be covering soon. Let's start with discussing the transition from the Olympics to the Paralympics and why it is crucial to give these games the recognition they deserve.
Yeah, the transition from the Olympics to the Paralympics is fascinating, and it's an important part of our global sports calendar. While the Olympics, we captivate a worldwide audience, the Paralympics follow very closely behind a few weeks later, but sadly, they don't always or haven't always received the same attention and recognition. The Paralympics, much like the Olympics, are a showcase of the best athletes in the world. Athletes that have trained for years, overcome significant physical challenges, and they're able to compete on this world stage. The term Paralympics itself is derived from the Greek preposition para, meaning beside or alongside, highlighting that the Paralympics exist in parallel with the Olympics. Did you know that the space between the Paralympics and the Olympics actually allows times for the venues in the Olympic Village to basically transform and be able to accommodate all of our Paralympians? It can take up to a week to transform the Olympic Village into the Paralympic villages. These venues, these transformations allow increased access for wheelchair capacity by removing or rearranging the existing seating. For example, there's a stadium that may have 568 spaces they were describing that will then be transformed to 394 basically for the Paralympics. They also have blind spectators that will be supplied with audio guides, while those with hearing impairments may be seated in direct view of large screens so they can follow the action. However, the reality is that the visibility and the media coverage of the Paralympics is also often far less than what we see at the Olympics.
This is something that we need to address, and they both need the equal coverage, equal attention. And I think this is a great story because I think the critics find Paris as a city that is unfriendly to people with disabilities. Now that they are building a state of art Paralympic village, I think maybe the city will learn from building a friendly city for people with disabilities.
Yeah.
The athletes competing in the Paralympic, they deserve recognition, they deserve support, they deserve celebration, just as much as those in the Olympics. These games are not just about competition, they are about breaking down barriers, changing perceptions, and showcasing what is possible when we focus on ability rather than disability. I think it's the right word. We are
That's
talking about
powerful.
huge abilities here.
Yeah.
The Paralympics has an interesting story. They originated in the aftermath of the World War II when a hospital outside of London began hosting games for newly disabled veterans as part of the rehabilitation. These games eventually evolved into what we now know as the Paralympics. The first Paralympic Games was hosted in Rome, Italy in 1960. The competition featured 31 athletes from 10 countries in 25 medal events in Rome. Since then, the sport has grown consistently, and more than 100 countries have now won at least one Paralympic medal. In Tokyo 1964, the program was expanded to 42 medal events, with wheelchair racing making its first debut. Starting August 30th, Paris is expecting up to 1969. I'm going to revise here. It's starting August 28th.
Yeah.
Second, I'll edit it. Starting August 28th, Paris is expecting up to 1,069 athletes, who will compete across 1964 medal events, from athletics to wheelchair basketball to swimming. Instead of the traditional interlocking Olympic rings, in Paralympics there is the agitos, the three swoops in red, green, and blue that represent the Paralympic motto, spirit in motion. I love this
I
quote.
love that.
I love this motto. The sports is so interesting on how athletes adapt and play. You have the focus and concentration of boccia and para archery, and you have the total chaos and carnage of sports like wheelchair rugby and the skill and communication involved in blind football. I have always found the sports to be hugely intriguing and engaging to a first-time viewer. I'm looking forward to watch the Paralympic Games.
I'm so excited to see them and seeing that there's more sports coverage. I think it's so impressive to see the level of athleticism and skill on display, and just how these athletes have overcome adversity in order to still be able to participate in so many of these sports. I feel like these athletes train just as hard as their Olympic counterparts. And like I said, they often have to overcome challenges and things related to their disabilities, and to be able to have like a healthcare team to help with, like blisters from on their skin and just different things. I found it so interesting. But the Paralympics provide a platform for these athletes to shine. And it's crucial that we give these games the recognition that they deserve, both in terms of media coverage, social media, and public support. Today, the Paralympics is a favorite for athletically inclined individuals in three specific categories of disabilities. So they have physical impairment, visual disabilities, or intellectual disabilities. Paralympics welcome athletes from 6 main disability categories. We're looking at amputees, cerebral palsy, intellectual disability, visually impaired, spinal injuries, or les autres, which is French for the others, is a category that includes conditions that do not fall into categories mentioned before. So, in order to participate in the Paralympic Games, athletes must fulfill certain criteria and meet certain qualifying standards to be eligible. The minimal impairment criteria helps determine which sports the athlete is eligible to play in. Once the athlete is deemed eligible for a sport, the Paralympic classification panel determines the class an athlete competes in. In order to stream in athletes, they have to go through very rigorous testing of function and movement for a sporting medical profession to give them a specific classification. So let's go, for example, with swimming. Swimming has 14 classes, and they're basically described as S1 through S10, which are variations in physical impairment, with 10 being the least disabled. And it covers everything from amputees to spinal cord injuries to someone with dwarfism. Then you have S11 through 13, which are allocated for visual impairment, and S14 are those for intellectual disability. I just find it so interesting. They have been able to group everybody together in order for people to compete against those like them and be able to just have that same experience of being an Olympian. These criteria and standards are sport specific and determined by the Paralympic Committee, which is very much like the IOC or the International Olympic Committee. Sports chairperson, the sports technical delegates, and the relative international sporting organizations. The Paralympians are elite performances and performing athletes, where the athletes go through stringent, like I said, qualification process so that the best and highly qualified are at the Paralympics and able to compete in the games. So what I find truly fascinating about the Paralympics is the innovation of sports equipment that empowers these athletes to excel. Neilham, can you talk a little bit about, after we've talked about the different criterias and the different disabilities, can we talk about some of the cool things that have been found to allow these athletes to compete at the highest level?
The cool is the right word, because when I see the photos from para athletes, they look like robots to me. They look so cool, and I'll explain which of these devices make them so cool. So the first thing is the racing wheelchair.
Oh,
In
yeah.
track and field events, the wheelchair isn't just a mobility aid, it's a piece of high-tech sports equipment. These racing wheelchairs are incredibly lightweight and designed with aerodynamic precision, allowing para-athletes to reach remarkable speeds. The next one is prosthetics for amputees. Athletes with amputations often use prosthetic devices which have evolved into sleek, high performance tools. In track events, leg prostheses are required, but in field events, they are optional. Have you seen how advanced and athletic
Oh,
these prosthetics have become? They are truly a fusion of engineering and athleticism. Just a
they're
while ago,
crazy.
yeah, they are. We were just speaking about this US couple, para couple from the US Paralympic team. Reminds me of the name of the athletes.
Hunter and Tara Woodall, like
Yeah,
his his blades that he runs on, and it was interesting to hear his story of like how his prosthetics have changed over time and all the science and the fine tuning that he works with his medical team on getting those prosthetics in tune to his body. I found really interesting story.
yeah. I think it's quite interesting too. The next item is tethers for visually impaired runners. Runners with visual impairments often use rope tethers to connect with their sighted guides. The partnership is so precise that if the guide crosses the finish line first, it's grounds for disqualification. In events like the long jump and the triple jump, blind athletes rely on their guides for auditory cues, with guides clapping or shouting commands from a stationary position to direct the athlete through their jump. I also find the collaboration there very interesting. There
That's a
was
lot of trust with a partner.
yeah,
um I don't I think we'll talk about it a little bit, but I found it interesting to hear that many of the Olympians serve as guides for Paralympians. So you'll have many of the track and field athletes that
yeah.
competed in the Olympics serve. I thought that was super cool.
Yeah, I also read a story about a Brazilian Olympic athlete who is like a guide. I think the athlete was called Felipe Veloso.
Yeah.
They won a medal together in Tokyo 2020. So this was a very inspiring story to me. The final one, last but not the least, tappers for blind swimmers. A critical tool for blind swimmers is the tapper. It's a long pole with a soft circular ball on the end. Positioned at each end of the pool, tappers signal to the swimmer that the wall is approaching by tapping them gently on the head. This allows swimmers to maintain full speed without the fear of crashing, trusting in their tapper to guide them safely. Paralympic athletes are also subject to the same list of banned substances as Olympic athletes. Anyone who requires additional medication for pain or treatment must apply for a therapeutic use exemption. We spoke about this in our earlier episode.
Mhm.
Each application will be considered on an individual basis by a medical committee. The same goes for Olympic athletes. There is a common misconception that a lot of Paralympians will be on prescription drugs. That is not the case at all. Obviously, there are athletes with spinal injuries and they need pain relief, but mostly it is the same as the Olympics, things like asthma and diabetes. According to the IOC, there are commonly prescribed medicines for para athletes, and these are antispasmodics, medicines to treat neuropathic pain, medicines to treat neurogenic bladder.
Okay.
Because most common illnesses seen in para athletes were skin complications and urinary tract infections. Skin complications usually come from using, for example, prosthetics. Speaking about therapeutic use exemptions, they are granted with a defined dosage for a specific period of time. The banned substances are the same in both the Paralympics and the Olympics, as I mentioned. And athletes on prescription medication must prove that there is no suitable alternative that they could take instead. I should also add here that the para athletes have specified doping testing procedures. For example, to take a urine sample, catheter used is the responsibility of the athlete. Although not mandatory, it is recommended that athletes use sterile catheters. We spoke about the equipment, we spoke about medicines. Anything else that we need to touch on, Jess?
Yeah, I think we can probably touch on the fact of media coverage. Social media coverage plays such a big role in shaping public perception. And unfortunately, the Paralympics and the Special Olympics don't receive the same level of attention as the Olympics. And we need to work as a society in recognizing the athletic achievement that comes in many forms and with all athletes, regardless of their abilities. Every athlete deserves to be celebrated in what they have accomplished. Thankfully, this year, as support for the Paralympic soars, NBC has said that it is expanding its coverage to match the Americans' viewers' interest and passion, and that they will have much more coverage. And I did see recently that many of the Paralympic events have actually even sold out of tickets in Paris, which I thought was really cool to hear, is that a lot of their venues are selling out because of the increased interest in Paralympics. We've been hearing, in the US that NBC will be having more coverage by having more commentators on the ground, more cameras in the venues, and more hours to watch. They also noted that they will have expansive coverage dedicated to giving the Paralympics the much deserved spotlight in Paris, especially as we get ready to go into LA 2028. So thankfully, we're starting to see more diversity and media coverage of all these equally amazing athletes, and I can't wait especially to hear the captivating stories and put some new names in the spotlight that we may not recognize. So I think it's very important that we also highlight the media and the importance of that for these athletes. I guess the next thing is kind of move, as we have discussed the importance of the Paralympics, is to kind of discuss a little bit about what is the Special Olympics. And while we've said both of these events focus on athletes with disabilities, they are distinct in their purpose, structure, and the populations they serve. So Neilham, do you want to kind of dive a little bit into Special Olympics?
One of the most common misconceptions is that the Paralympics and the Special Olympics are interchangeable. They are not. Like Jess said earlier, the Paralympics primarily focus on athletes with physical disabilities, although there is also a category for athletes with intellectual disabilities. The classification process in the Paralympics is rigorous, ensuring that athletes compete on a level playing field. The sports themselves are often adaptations of Olympic sports designed to accommodate the various physical challenges the athletes face. For example, in track and field, you might see athletes using prosthetics, just we mentioned, or competing in wheelchairs. In swimming, there are athletes with varying degrees of limb loss or visual impairments. The emphasis in the Paralympics is on elite performance, with athletes pushing the boundaries of what is possible. In contrast, the Special Olympics is designed specifically for individuals with intellectual disabilities. The philosophy behind the Special Olympics is inclusion and participation. There are no minimum qualifying standards, unlike Paralympics or Olympics, and athletes of all ability levels are encouraged to participate. The goal is to provide opportunities for physical activity, social interaction, and personal growth rather than focusing solely on elite competition and performance.
Yeah. I think you did a great job of kind of explaining the key distinction. A little bit of background on the Special Olympics. So the Special Olympics were founded by Eunice Kennedy Shriver in 1968. She spent her life campaigning for more rights and acceptance of people with intellectual disabilities. And in 1968, 1,000 athletes from the US and Canada marched into a stadium with flags and banners as the first Special Olympic World Games. Today, Special Olympics is the world's largest sport movement for people with intellectual disabilities, with more than 5 million athletes in 174 countries, and it is officially recognized by the IOC. Unlike the Paralympics, which happens every 4 years alongside the Olympics, the Special Olympics host year-round local, regional, national, and international competitions. I actually have multiple patients that compete in the Special Olympics. And for them, even on a local level, I will get phone calls on the weekends that they have won a blue, a white, or a red ribbon. And I think the joy and the excitement that comes when they call to tell me that they got a ribbon at an event is probably the equivalent of most Olympians winning a gold medal. Like my patients, I love that they compete and they are so excited to share how they did and what they're competing in. It just makes me like their joy is contagious, it's uplifting, and it's one of my favorite things. The Special Olympics does have World Games, and so they have a World Games that's held every 2 years, and that is kind of their pinnacle of competition, bringing together athletes from around the world.
Yeah, that's so great about Special Olympics. It's such an inclusive environment
Yeah.
where every athlete, regardless of their ability, has the chance to shine, be happy, grow as a person, and engage into a community. That
Yeah.
is important to be healthy individual. And to be eligible to participate in Special Olympics, athletes must have an intellectual disability, a cognitive delay, or a development disability. There is functional limitations in both general learning and adaptive skills. It's a community where they can be themselves with people like themselves. So I think it's a safe space, and this is provided by sports. Further requirements about the Special Olympics are age. There are training opportunities for children and adults with learning disabilities of all skill levels. However, a child must be at least 8 years old before engaging in any sports. Then the other requirement is to have a documented intellectual disability. Individuals interested in participating in Special Olympics must have documentation from an agency or professional diagnosing them with an intellectual disability. Special Olympics welcomes all athletes with intellectual disabilities. Age must be 8 and older of all ability levels to train and compete in over 30 Olympic type sports. The athletes are grouped into divisions based on their age, gender, ability level, ensuring that the competition is fair, enjoyable for everyone involved. I think it represents Olympic values, excellence, friendship, and respect. It's just the same across Paralympics, Special Olympics, and Olympics. It's a powerful reminder that sports can be a force for good, promoting acceptance, understanding, inclusion, and being a part of a community. It's
Yeah.
so heartwarming. I haven't watched the Special Olympics, but now I will. Now I know.
I I love I just between my brother and my patients, like it definitely opened my eyes to the need for that community to be able to compete together in the aspect of what sports brings in community and the power of self-confidence and so much. So I love that the Special Olympics is just thriving. And I think there's one area, obviously, that some people may be wondering is about the healthcare, or like, what do they do? Do they drug test them? Things like that. So the Special Olympic athletes are not subject to the same anti-doping control requirements as non-Special Olympic athletes. They do often need to take, they do have to take legally physician prescribed medications for often many daily and health conditions that they might have. Athletes must undergo a health history and physical exam and get clearance from a licensed healthcare provider before registering for games. And the exams must be done within 12 months of the game. The professional's identity, licensure, and contact information must be very clear in case somebody needed to reach out to them. Some healthcare providers actually may even hesitate to certify disabled athletes for sports participation, fearing the athletes competing, it may be dangerous. Others may avoid providing medical coverage for Special Olympic athletes for various reasons. But in reality, Special Olympic events carry much lower risk of injury than similar activities by non-disabled athletes. Between 2.8 to 3.9 of Special Olympic athletes require medical attention during competition, which is a pretty low amount. Most medical encounters are for trauma-related injuries, not for actual medical conditions. The most common related injuries are minor sprains and strains, contusions, and abrasions, typically in lower extremities. Track and field events appear to result in the most injuries, but it's also got the largest amount of participants. The most common reason, other than injury, for seeking medical attention when we see Paralympic athletes is abdominal pain, often caused by indigestion or maybe even nerves. Abdominal pain in conditions that require medical, or after abdominal pain, other conditions that we see require medical care are seizures in persons that are predisposed to them, and heat illnesses, sunburns, and also often eye injuries. And that's oftentimes we see mainly because the guys are applying sunblock and it's getting in their eyes. And so now they're having irritation in their eyes. But in general, most injuries in the Special Olympics are minor, and many can be prevented by athletes receiving careful and attention care, and just having a team supporting them, and also having their medical provider supporting them in helping them wanting to compete and having them have the ability to safely compete.
Mm-hmm. The Special Olympics, as far as I understood, is offering also some sort of inclusive health to special athletes. This is great as we talk about the Olympic medical services. I think the special athletes are also getting good medical care and support,
Yes.
patient and during the event. Our listeners may wonder, I checked up when would be the next Special Olympics. So the next one is going to be the Winter Games in Turin, Italy, Torino,
Oh, fun.
2025. Yes. And the next one, Special Olympics USA Games, is going to be in Minnesota in 2026. I guess my co-host is going to be there as a pharmacist.
I would
I
love
hope
to.
so.
Yes.
And that would be so much value that I think a sports pharmacist would contribute. We also can't overlook the value of sports, movement, and community for these special athletes. The majority of athletes, 74%, participate in training activities and attend practice at least once a week. It's so good to have a goal to just grow as a person. And many athletes, 53%, also engage in social activities with teammates outside of training and competition several times a month. This is more than I do. It's so great to have such engagement.
I love that. It gets them moving.
Yeah,
So many people, like, especially with like my brother, it's hard to convince him that he needs to go walk. But
yeah,
if you can kind of tell him, hey, we're going to go play this sport, we're going to go do something, and then he's going to go see his friends,
yeah,
he's so much more apt to doing it. So I think it's a great way to get them moving and involved when sometimes it's hard to kind of rationally explain it to them that they need to do it.
exactly. I think it's tied to up some emotions.
Yes.
Great, and it's provoked by sports. It's just great. Like yourself, athletes, families, coaches agree that the typical athlete participates in Special Olympics for enjoyment, social aspects, and competition. These reasons were consistent for both active and inactive athletes, suggesting universality in athletes' reasons for participating in Special Olympics.
Yeah. I think definitely sports just spans the importance of, not only mental health, but community and different way. And it's cool to see people coming together in different ways to support people of all abilities. So, it's neat to highlight both Paralympics and Special Olympics in this episode. And I think it's really important to, we highlighted the differences between the Special Olympics and the Paralympics and the importance that these events play in the world of sports. And as sports pharmacists, we have a role in supporting athletes with disabilities through medication management and ensuring that they have access to the resources they need and advocating for their inclusion in all levels of competition. I think that as pharmacists, we can make a difference in helping those athletes feel comfortable in participating in sports. We also need to make sure that these athletes receive the recognition they deserve, whether it's the Paralympic athletes pushing the boundaries of elite performance or the Special Olympic athletes that embody the spirit of inclusion and participation. Their achievements are worthy of celebration.
Completely agree, and we look forward to sharing more Paralympic and Special Olympic stories with you. As we record this episode today, the Paralympics will kick off tomorrow, and we are so excited. And we'll be having one more episode on Paralympics to share interesting medical highlights. We hope that all the athletes will be fine, but it's inevitable to have some medical highlights. So we'll be sharing these interesting highlights from you in our next episode. But
Yeah.
wrapping today's episode, I would like to leave our listeners with this thought. The Paralympics and Special Olympics are not just sports events, they are movements. Movements that challenge our perceptions, push the boundaries of what is possible, and show us the true power of sports. Whether you're watching the Paralympics in the awe of the athleticism on display or cheering on a Special Olympics athlete as they cross the finish line, remember that these athletes are deserving of our support, recognition, and celebration.
I think that's so well said, Nilham. And I love the they're not just sporting events, they're movements. I feel that's so powerful. And I think it's important to continue to champion these athletes and the organizations that actually support them. The Paralympics and the Special Olympics may differ in their structure and their purpose, but as we've said, there's a common goal to showcase the incredible abilities of athletes with disabilities and to inspire us all to become more inclusive, more accepting, and more understanding.
It's the world we would like to live in for
Yeah.
the Olympics, for the Paralympics, and the Special Olympics. And as you said, this is a moment for us to remember these important values. Thank you for joining us on this episode of the Performance Prescription Lab podcast. If you enjoyed this discussion, please subscribe, leave us a review, and share this podcast with your friends. As sports pharmacists, our mission is to provide accurate and evidence based information to optimize your health and performance. When it comes to your health and well being choices, consult with your physician or pharmacist, prioritize safety, and always make informed decisions. Thank you for joining us today. Until next time, keep pushing the limits and embracing the power of sports.